Good morning, everybody. Welcome to One Step Radiology Daily. Today, I am going to discuss about various barium studies practiced mostly in the oncology practice. So, what is a barium study? Barium study is a barium X-ray or a radiographic X-ray examination of the upper GI tract and lower GI tract, upper and lower GI tract, used to diagnose in the various abnormal, benign, and malignant conditions. So there are various types of barium studies: barium swallow, barium meal, barium follow-through, small bowel enema, also called enteroclysis, and barium enema. Barium swallow is nothing but X-ray examination of the study of the upper GI tract, like mostly from the oral cavity to esophagus. Barium meal examination of the lower esophagus, stomach, and duodenum. Barium through is the examination of used to study of the small intestine with repeated X-ray and fluoroscopy examination. Barium small bowel enema, also called enteroclysis, is a barium X-ray examination used to display individual loops of the small intestine by intubating the jejunum and administering barium sulfate followed by methyl cellulose or air. Barium enema, it is examination of colorectal area and large intestine, and it is classified under lower gastrointestinal. So there are uses of barium studies, various studies. Maybe you may be structural, you study the mucosa, malignancy, and ulcer. Sometimes you would study the motility, achalasia, swallowing, and hiatus hernia. Mostly used for the malignancy like carcinoma, ulcers, growth, and strictures. Benign also you can see the strictures, achalasia, and hernia. After giving the barium, they take X-ray either from AP, PA, lateral, obliques, in supine position, prone position, and serially scans and fluoroscopic examination. It depends upon the need. What is a fluoroscopy? Fluoroscopy is an imaging technique that uses X-ray to obtain real-time moving images of the interior of the object. So fluoroscopy is in the wide variety of examination procedures from the diagnostic to therapeutics. So this is a fluoroscopic examination. You can see patient is swallowing barium here. You can see the swallowing pictures from the upper esophagus, upper oropharynx, hypopharynx. You can see the various bony structures, soft tissue structures. Let's identify. Another thing is called double contrast barium examination. In double contrast, apart from the barium, there is a gas producing agent is introduced with barium. So there is a two contrast, either double contrast. One is positive contrast and negative contrast. Positive contrast the barium or barium like agent like gastrographin. Negative contrast air or carbon dioxide. The double contrast study is sensitive to visualize mostly mucosal irregularities. Better and you can see the better distance and separation of loops. So what is a barium sulfate? Barium sulfate is an inorganic compound that is known as BaSO4 chemical formula, and it is a crystalline solid odorless insoluble white compound. Barium swallow also some sort of side effects. If there is a fistula or some aspiration happens, you can see in this picture I think it is a tracheoesophageal fistula aspirated to the lungs. If there is some sort of constipation, and people some have anaphylaxis and barium impact. Mostly it is contraindicated in the hypersensitivity people, obstruction, if suspect obstruction, perforation, and fistula. So better not to do in this condition. So barium swallow, what is barium swallow? In here the barium you have to swallow the barium, and radiologist has to take the series of X-ray from moving through the mouth and throat to the esophagus. Sometimes we show the swallowing properties, so we ask to hold the breath or swallow during the examination and fluoroscopic examination. You will have a given thinner barium to drink to swallow. So you can see in this picture where the barium path you can see from the oral cavity to oropharynx, hypopharynx, esophagus, and stomach. So you can identify the various structures. There are two bulges, W structures. You can tell is a W structure. It is a smooth W. The upper part is called vallecula. Lower part is called piriform fossa. These are the 8 folds and piriform fossa. You can find out this is the tongue, this is the vallecula, this is the hypophosphoropharyngeal wall, this is soft palate, and this is the laryngeal parts. You can see here there is some aspiration to the there is a you can see the laryngeal structures also. Here you can see this is the vallecula, this is the piriform fossa, and there is aspiration to the some laryngeal structures, larynx. Barium meal, an upper gastrointestinal series also called a barium meal. It is we take the radiologist to take series of radiographs to see the upper GI tract abnormalities, mostly esophagus, stomach, and duodenum. So what the procedure? Patient should take laxative at least in empty stomach, and to clearly visualize the structure, patient has to do the pre-preparation before the procedure. So in this barium meal, we can see the stomach and lower part of upper GI tract. You can see the notches. You can see the duodenum second part, duodenal first part, pylorus, and pyloric antrum. You can see if you given air with double contrast, you can see the mucosal lines so clearly here, and this is the barium meal. Another examination is called small bowel follow-through. In small bowel follow-through, fluoroscopy technique designed to obtain high resolution images of the small bowel. We can see the motility of the small bowel. It is often performed after upper GI fluoroscopic study. The small bowel follow-through is a single contrast study. So you can see this follow-through examination. So you can see the barium meal plus follow-through. You can see the various sides. It is the stomach. This is the body. This is the antrum. This is the duodenal cap. This is the pyloric antrum. This is the second part. This is the third part. This is the ileum. This is the jejunum, and this is the barium meal. You can identify the various structures. Small bowel and barium enema. Another procedure where it is called endoclysis. Here two procedures. They will intubate till jejunum and infuse till in jejunum, and they give the barium contrast, as well as they will give IV contrast, normal IV contrast. It is a significant small bowel distension compared to CT angiography. So you can see very, and patient will have some distension. You can see the constrictions here, stricture. Barium enema, another lower gastrointestinal series, a medical procedure used to examine the diagnose the colorectal problems. So radiographs are taken while barium sulfate contrast is given from the via an enema through rectum, and it is passed into the rectum. It's slightly they can push into the air as a double contrast, or to push the barium to the colon. This is called, if there is called, this is air they give, after that is called air contrast barium. So they will take barium, they will put the in pararectal the barium lubricated enema to be placed in the rectum. They will push the mixture, and X-ray taken after 15 to 20 minutes. So this is the various large intestine barium enemas. You can see well here the various structures: rectum, sigmoid colon, descending colon, transverse colon, ascending colon, and cecum. Nowadays, the imaging correlation is done with the CT colonoscopy, endoscopy, and the DC colonoscopy. These are the procedures which replaced in various barium swallow examinations. And after procedure, some patient may feel abdominal bloating, leads to constipation. They need some drink. They should drink plenty of water, fruits, and vegetables. Stool may be whitish for few days. Thank you very much. Hope you liked it. You can share it, subscribe it, and comment it. Thank you very much.